Well, hello, my name's Julie McCrossin, and I'm a survivor of head and neck cancer, and I live in Adelaide in South Australia. And for World Cancer Day, the 4th of February, the theme is Close the Care Gap. Everyone deserves access to cancer care. And it's my great pleasure to welcome Maureen Jansen, who's a head and neck cancer survivor and a patient advocate. And she is a key organiser of Head and Neck Cancer Support Aotearoa in New Zealand, which is a charitable trust. And she's speaking today about the gaps in care for head and neck cancer patients in New Zealand when compared to Australia, which of course is just across a body of water we call down here the ditch. Welcome, Maureen.
Hello, Julie.
Hello. Now, look, I think the first key thing you want to say is a gap between Australia and New Zealand for head and neck cancer patients is access to immunotherapy, particularly Keytruda and Opdivo. In a nutshell, why is that gap important and why must we close it for Aotearoa, New Zealand?
The gap is important because for about 20% of advanced head and neck cancer patients, Keytruda or Opdivo will give them some chance of longer life, even a cure. At the moment, it's $90,000 if you get into that position where surgery, radiation and chemo haven't worked. You qualify, according to our MedSafe, for immunotherapy, but it is not funded by the government. It has been funded, Opdivo, since 2018 in Australia and Keytruda since 2022. It hurts a lot that a country so similar to ours provides this treatment free. It's not a magic bullet, but I know our surgeons and oncologists desperately want to be able to offer it to their public patients.
And Maureen, before we leave immunotherapy as a topic, I think the current government in New Zealand has made a promise about this. Is that right?
They have, yes. They will fund 13 cancer drugs that are funded in Australia but not in New Zealand, and Opdivo and possibly Keytruda are two of them.
Okay, so there is some hope on the horizon.
There is. I'll believe it when I see it.
And can I just say that as a fellow member of Head and Neck Cancer Support Aotearoa, all the way from Australia, you know, you have a website, you have a Facebook group. So I'm in contact with New Zealand patients, and it's just a shocking difference because here in Australia you get access. Look, let's go to your second key gap that needs closing for head and neck cancer patients. Lack of funding for head and neck cancer dentistry. And could I just say, one of the reasons you're wearing your mask today is that you have severe dental and oral issues. You're having surgery tomorrow, and we thank you, additional extra surgery tomorrow, and we thank you for being part of this conversation. What's the gap we need to close in dentistry?
Well, the gap is after radiotherapy, there is a lot of damage to many patients' teeth. The government has never funded post-treatment care for ordinary dental care adequately. Even now, after a big improvement, I have seen our specialist dentistry department stressing out over the fact that they don't have adequate funding to supply what patients need. The specialist dentistry department in Auckland is expected to care for special needs patients and children, and there's not adequate funding for adults with head and neck cancer. I have to say it is improving. They are offering implants now. I've got implants and might get more. But as a member of an oversight group, I feel, and a patient group, I feel very strongly that this is a huge gap.
Exactly. And I should say that Maureen wants to be clear that she's very happy with her own treatment and her own cancer team, and she has faith in them. But because of her multi-year involvement in a support group for other head and neck cancer patients in Aotearoa, New Zealand, she is aware of many, many people who suffer terribly because of lack of access to dentistry. Might I say it's an issue in Australia as well, but a very big issue in New Zealand. Another gap that needs to be closed in New Zealand is you have no comprehensive cancer centres. In Australia, for example, in Sydney, we have the Chris O'Brien Lifehouse, in Melbourne, the Peter MacCallum Cancer Centre, and others. Why do you believe you need a comprehensive cancer centre in New Zealand, Aotearoa?
Well, data shows that people in America and Australia, that patients do better if cancer care is centred in one main hospital. In my case, I go to 3 different hospitals in Auckland for scans, for dental care, surgery and radiotherapy. It would be a dream come true if we could afford a comprehensive cancer centre like Peter Mac or Chris O'Brien Lighthouse.
I mean, apart from the value of multidisciplinary teams and improved communication, and there's good evidence that improves survival and quality of life, there's just the stress for you, Maureen. You're over 70. I think you use public transport a lot of the time. You travel distances. And to keep moving between locations, to get them to know what each other have done, it must be an enormous stress on you.
Yes, yeah. I have a very good team. I've been with them since 2009. I know them. They're really good to me. But the geography of Auckland means that I have to travel vast distances for most of my dental care. That's not uncommon. You'd find that in Australia too. But it would be a dream to have one hospital that does it all.
We just have one last gap that needs to be closed for head and neck cancer patients when you're comparing Australia to New Zealand, and that is access to proton therapy, which is an advanced form of radiation therapy. It's now available in the United Kingdom, the United States, Denmark, and some other European nations, India, and will soon be available in Adelaide in Australia at the Australian Bragg Centre for Proton Therapy and Research. Why do you think it needs to be available in New Zealand?
The side effects from radiotherapy are awful for some of us, not all of us. Radiotherapy is a wonderful tool that has cured many, many head and neck cancer patients. But although they're trying to target radiotherapy more and more, proton therapy will be another step up. We will send New Zealand patients to Adelaide, but only children who need it more. For adults, it's going to be a long time. Small country, big expense. Our radiation oncologist said it really won't be affordable within a decade.
Maureen, can I just thank you so much for being an advocate for your fellow head and neck cancer patients, particularly the day before you're going for yet more surgery on your mouth yourself. And Maureen is very active in Head and Neck Cancer Support Aotearoa, which is a charitable trust in New Zealand, and they have a website, and a Facebook page. And Maureen will also be writing a blog giving more information about access to immunotherapy, lack of funding for head and neck cancer dentistry, the lack of a comprehensive cancer centre in New Zealand, and lack of access to proton therapy. And we look forward to seeing you again. Thank you, Maureen.
Thank you.